So when we asked for this information, as you say, there's 314 people in Clare waiting for home care support that they have been promised, and that's 1,871 hours of home care not being delivered. And I raised this in the Dáil 6 months ago, and I was told the same thing. Then there was only, well, not, I wouldn't say only 304 people, because that's still quite a lot of people waiting, but that's gone from 304 people on the waiting list to today there are now 314. So clearly they've utterly failed to address the problem in the interim. And throughout the state, the number of people with unmet need for additional hours rose by 17% in just 1 year.
So we're seeing a rise in that, and as you say, you've raised this before and it hasn't been addressed. What are the HSE telling you in relation to this? You mentioned recruitment, but does it seem that there's any effort underway to seriously tackle this issue?
Well, they say they're trying to solve this issue, but obviously you can see that by the fact that it's rose by 17% that it isn't happening. And you know, these are people that are needing help now. They can't wait. There's people in hospitals that cannot get home because they can't get home unless the home care system is set in place. There's people out there that are having to take time off work to help their loved ones because they're waiting for this home care package to come in. And it's just like all of a sudden you're thrown into having to care for someone when you've no experience, you've no, you know, it's really not fair on people to do this. And to me, it seems like they're just reliant on people's goodwill to do this, and it's not fair. And it's just shocking. To be honest, it's a shocking indictment of the government's failure on this issue.
And it can be argued that there are knock-on effects as well, because if somebody doesn't get home care in the home, they're going to have to go into a healthcare facility to receive that treatment.
And that's it. Sometimes when you don't receive the right care at the right time, you end up longer in hospital, you end up with more complicated issues. So then it puts more money onto the state and more beds being taken up in hospital then.
Recruitment obviously is a major problem across the HSE, across the health service in a variety of areas. Indeed, we heard that today in our news in relation to the CDNT teams, the Children Disability Network teams in County Clare. In order to address the problem here with regard to home care, Donna, what would you like to see happen? What approach would you like to see taken to recruit and retain staff?
Well, we would have a home first policy. We have a good policy on that. My colleague David Culnan has that. And you need to work with home care workers to improve their career development, but the recruitment and attention, but also carers pay. That's one of the issues that is happening here. But even delivering 2,000 community beds would help. We need to mandate the Commission on Care to develop a care strategy and a funding model for ageing and older people with priorities, independence and care at home. And this is all about care in the right place in the right time, and it's all about giving people independence at home, you know, and that need for not having to go into hospital, or even those that are stuck in hospital can't get home because of the care package isn't in place. So we need to fund the increase of hours that is out there, but it has to be publicly funded. And we need to reduce privatisation in the care sector, because this is where we're seeing the issues with the carers workers, their pay and the retention in the services.